Some people get their toenails removed on purpose, and this is usually done as a last resort before running a marathon.
That's really painful.
You see, during long-distance running, your toenails repeatedly hit the front of your shoe, and this is painful and can make your nails blackened, which could cause them to eventually fall off.
So apparently this is done by a small subset of ultra marathoners. And basically this can cause subungual hematomas. Basically that's a blood collection underneath the toenail, which can be extremely painful. And if that happens in the middle of the race, they're not going to be able to finish it.
So some extreme runners choose to just remove them before the race to prevent this altogether.
So there are a few other solutions exposed to getting this extreme. One, you could wear properly fitting shoes, keep your toenails short and trimmed, using toe protectors or silicone toe pads. And I would not recommend doing this by yourself. Removing your toenails is actually considered a medical procedure.
She danced along to music while operating on her unconscious patients, and she would post the videos online, even singing as she cut into someone's face. But when a woman went in for liposuction, she had a heart attack on the operating table. And when she woke up, she had severe brain damage and had to use a wheelchair.
So this is actually a true story. This lady's name was Dr. Wendell Davis Buett, who was in Georgia. She's actually a dermatologist who is performing Brazilian butt lifts and tummy tucks, which, dermatologists don't have that type of training and really shouldn't be doing those type of procedures. But I guess she was doing it in his office, which is illegal in Georgia.
After seeing the doctor's videos, the family was shocked. They sued her for being distracted during surgery, and she lost her medical license, putting an end to her career and her channel.
This is really horrible. This is what gives doctors a bad name. And if you go for Brazilian butt lift, tummy tuck, something invasive like that, make sure you find a board-certified plastic surgeon, not a dermatologist.
The gum exploded inside his mouth the moment he started chewing. You see, before chewing gum, he liked to dip it in citric acid to make it sour.
This is actually a true story. This was a gentleman, 25-year-old chemistry student in Ukraine, named Vladimir Lekonos, who tragically died doing this. He was working on an experiment involving explosive chemicals when this happened. This is crazy.
But one night, he accidentally grabbed the wrong jar. Instead of citric acid, he coated his gum in an explosive chemical, and it instantly destroyed his jaw and lower face. His family heard the blast and ran to his room, but he was already dead.
This is really tragic. He had a passion for chemistry, and unfortunately it led to his untimely death.
If you jumped out and aimed for a giant trampoline, you might think it would bounce you hundreds of feet back up into the air.
That's never going to happen. At that rate, you're going to crash right through it, burn and die.
But in reality, hitting the trampoline at that speed would feel like slamming into concrete. The force would cause the fabric to rip instantly, and the springs and metal poles would bend and snap from the impact.
Absolutely, that's definitely not survivable. I would not recommend trying this.
You wouldn't even bounce, you just crash straight through to the ground.
That would be pretty ugly.
The parachute released, but for some reason it didn't open, and she fell over 3,000 feet with the tangled parachute trailing behind her, blacking out on the way down. She crash-landed, breaking bones, including her spine and even her tooth.
Probably good she blacked out, because that would have really hurt. She must have been in a lot of pain when she woke up. I can't believe she survived that. The parachute must have opened enough to cause some resistance so it wasn't a complete free fall. This is a bizarre story, and she's really lucky to be alive.
She was rushed to the hospital where doctors tried to stop the internal bleeding, but miraculously she survived, and 5 weeks later she was walking again.
Wow, that's crazy. I bet though she has some type of ambulatory problems that's going to plague her whole life. She's just lucky to be alive.
She cried tears of blood when she woke up from surgery. You see, she was supposed to have work done on the left eye, but the doctor had operated on the wrong one. Realizing the mistake, he pulled out a needle and injected it into the correct eye. Then he grabbed a pair of scissors, and without gloves or proper tools, he started cutting. She screamed for him to stop, but he ignored her. And when it was over, she was left with permanent damage to both eyes.
This was actually based on a true story that happened in Chicago. Basically, after the case, the recovery room nurse noticed, why is she bleeding from the right eye when the procedure was consented for the left eye? And then the doctor did this right in the recovery room, and the patient in agony felt everything. But in any case, this was done in like 2017 in Chicago hospital, and I'm not sure exactly what happened to the doctor afterwards, but terrible situation.
After eating the fish, her lips, fingers, and feet turned black, and she was rushed to the hospital. Doctors discovered she'd contracted a rare flesh-eating bacteria. As the infection spread, her kidneys failed, and her doctors put her into a coma.
This is a thing. There is some bacteria in uncooked fish. It's called Vibrio vulnificans, which can cause this.
But she kept getting worse. Finally, the only way to save her was to amputate all 4 of her limbs.
This is really horrible. This comes from consuming raw or poorly cooked seafood, especially in clams, oysters, or other shellfish. They have an increased risk of Vibrio vulnificans entering the body.
If your leg is cut off, you could still have the urge to scratch an itch even though there's nothing there. This sensation is called phantom limb, and some people even experience severe pain on their non-existent limbs.
Yeah, this definitely exists. This can be a severe problem for amputees.
Now, unfortunately, most amputees experience this strange phenomenon, and with no limb to itch or treat, these amputees are left with no good way to remedy the situation.
But there is some treatment for this. You can try medications. Sometimes some tricyclic antidepressants work, anticonvulsants work, non-steroidal anti-inflammatories can help. You can do mirror therapy. The mind thinks there's something there, trick it back into thinking there's not. There's TENS, transcutaneous electrical stimulation, spinal cord stimulation, other psychological therapies that can be offered to alleviate patients of their symptoms.
If you have a bunion, a doctor can make a small incision and use a tiny saw to cut through your misaligned toe bone. Then the doctor will carefully reshape and align the bones to the correct position.
Sometimes when they go in there, they're also checking out the tendons and ligaments and doing a few maneuvers so that everything aligns straight.
To make sure they stay in place, a large pin is inserted into the bone near the top. 2 more pins are placed into the bottom portion of the bone, further stabilizing the toe.
So sometimes pins are used, sometimes screws and plates can also be used.
The surgeon starts with a small cut in the lower abdomen and moves through the fat layer underneath.
What happens during a C-section? Before that, there's anesthesia that's delivered, IVs are placed, the patient's monitored, usually a catheter is inserted in the bladder to get urine, and then the abdominal is prepped, and then the incision happens.
Then, they carefully open the tissue over the muscles and gently push the muscles aside.
This is usually done what we call a bikini cut, which is very low, many times in the bikini area, in the pubic area, so that the scar is less visible.
Next, they make a small cut in the uterus, deliver the baby, cut the umbilical cord, and remove the placenta. Once everything is clear, they stitch each layer back together for proper healing.
So usually throughout this procedure, there's monitoring that happens. The mother is moved to the recovery room. Pain management takes place, so her pain's minimized. And the hospital stay usually takes a couple days before the patient's discharged.
What if doctors had to remove one of your lungs? Sounds scary, right?
So this is called a pneumonectomy, surgical removal of the lung.
But it happens due to diseases like tuberculosis, lung cancer, or severe trauma. When this happens, the remaining lung expands and works harder to supply enough oxygen.
The other lung can compensate to a certain extent, and basically it takes up a little bit more room, pushing some of your organs to the side, but it is definitely survivable.